The list of things that have happened to PHC since this pandemic started is so long. I think the main thing that we've learned is that COVID points out your strengths as well as your weaknesses, and we've seen that in so many ways. Our people have really stepped up in terms of patient care. We've fixed some of our processes, but we've also seen that we need to be more careful about infection control, and all of that work has taken place so quickly. I think of two things that we need to both focus on as well as continue to show to our organization. First is preparedness. We need to be prepared for patients with COVID, for outbreaks, as well as making sure that we look after the patients that don't have COVID, that we still have a responsibility to. And the other main thing is communication. Things change so quickly, new information is coming, and the speed of the illness and the changes in the population are so fast that we need to make sure that our staff, our patients, the families that rely on us are understanding and clear on what their expectations are and what we expect of them. We learn from not only our experiences, but we also pay a lot of attention to outbreaks and COVID in other places, other nursing homes, other facilities, other regions. We are all very well connected to our counterparts around the province, and we share ideas and learnings from all of the COVID cases that we've had so that we can improve and then we can be more prepared for cases in the future. We've learned a lot about how COVID spreads and the infectiousness, a lot more about how to deal with this disease in our patients. But we do still have to be flexible. What we know is there is some level of unpredictability, and that means that we don't know exactly how many patients are going to come through our emergency doors and what the next few months will bring, especially as there are new innovations with treatment, vaccines, hopefully. So we need to continue to be flexible, to be able to flex up and flex down our work and our expectations in terms of COVID in our facilities. Just to clarify the process of when a person is transferred out of a nursing facility, it is true that the medical health officer has the final sign-off in terms of a person leaving and going to another facility. That is mostly for to make sure that we keep track of people that are sick and people that are at risk because they're in an outbreak facility. So the decision and the request to leave a nursing home to go to another place, for instance an acute care hospital, is made all together. The resident, the family, the most responsible physician make that decision in terms of requesting this. And this is based on the wishes of the resident and any advanced care planning that has been done. We do know that restrictions on visiting for patients and residents can be very stressful for the patients and residents as well as the families. As we see the numbers increase in the province and around the world, we do know that trying to keep our vulnerable patients and residents safe by limiting their exposure to others is working, and we need to continue to watch our visitor policy to try and balance the needs of the residents in terms of their socialization, as well as trying to keep them safe and decrease their overall risk. The visitor policies in both long-term care as well as acute care are provincial ones. There needs to be consistency around the province as well as within our region. So we don't make changes lightly. Things need to be coordinated so that we are not doing things differently from one part of the province to another. A lot of people ask me what is coming in the next year, and I think it will get better. This pandemic will mitigate or end. It will trail off eventually. Now is not the time to let up on some of our really good work that we've done in the last 8 months. We need to continue to protect ourselves, to make sure that we're using PPE appropriately. We need to make sure that we protect our patients and residents. We need to focus on infection control, wash our hands, wear masks, keep social distancing. This effort will pay off. It is paying off, and it will get better. This is not forever, and everyone's doing a fantastic job, and we should keep it up.